Good morning, I'm Antonio Carlo Galoforo, professor at the University of Pavia for Master second level in Oxygen Ozone Therapy and member of the Italian Scientific Society Oxygen Ozone Therapy. My speech concerns the scientific rationale on which is based the potentiality of the oxygen ozone therapy, widely used with positive effects on more than 50 pathological processes, for which I have dedicated about 30 years of my career. I will show you why and how ozone can be a strong intervention strategy to recover patients affected by COVID-19. I will describe the protocol steps for the therapy and different clinical trials reported in literature.
The ozone is a three-atomic oxygen molecule generated when UV radiation splits an oxygen molecule into two oxygen atoms, and the three oxygen atoms react with oxygen molecules to form ozone. Two most important events are relevant in the lengthy history of ozone: its isolation for Christian Friedrich Schumann in 1839 during experiments on the electrolysis of water at the University of Basel, and the first portable ozone generator patented by Nikola Tesla in 1896 in the United States.
The omnivorous properties of ozone are well documented and scientifically demonstrated, from immunoregulation and anti-inflammatory, anti-apoptotic activities to antioxidant function, antimicrobial effect, role in analgesic and vasodilatation, blood flow and oxygenation promotion, modulator of regenerative processes, and epigenetic modification. Some important works demonstrating the high potentiality of the ozone molecule are reported in Science, and evidence that our immune system produces ozone by antibodies to dispatch their bactericidal activity. Concerning the antimicrobial activity of ozone, it has been demonstrated that in bacteria, O3 disrupts the integrity of the bacterial cell wall through oxidation of phospholipids and lipoproteins. As this occurs, the stability of the bacterial cell envelope is attenuated. For instance, our work demonstrated that the bactericidal activity of ozone against gram-positive and negative bacteria was near to 100%. Concerning its antiviral action, it has been observed that ozone damages the viral capsid and breaks the reproductive cycle by disrupting the contact between the virus and the cell. Different studies demonstrate its antiviral efficacy, both in vitro and in vivo. For instance, in this in vitro study, different viruses lost their infectivity in few minutes after ozonization. In the case of COVID-19, it has been hypothesized that O3 interferes with the virus replication phase. Coronavirus is rich in cysteine, and these residues must be intact for viral activity. O3 is able to oxidate cysteine residues through the formation of disulfide bridges, inhibiting viral cellular penetration. Moreover, ACE2 receptor activity can be regulated and blocked through the control of NRF2, a nuclear factor on which O3 acts, interfering with the SARS-CoV-2 replication. When ozone is administered, it dissolves in biological fluids, determining a mild oxidative stress. It induces the activation of two transcriptor factors, NFAT and AP1, and stimulating the innate immune system to permit cells to survive injury. Besides to immune regulatory activity, ozone showed also anti-inflammation and antioxidant activities. Under moderate oxidative stress, O3 induces the ARA nuclear genes, antioxidant response elements, activates antioxidant cascade, decrease expression of pro-inflammatory cytokines, activates anti-inflammatory cytokines. For its role in the regenerative processes, ozone can increase the expression protein levels of the growth factors such as VEGF, HAF1A, PDGF, as well as for transforming growth factor beta-1 and interleukin-8, epidermal growth factor and TGF-alpha. Ozone increases the expression protein levels of fibroblast marker genes such as collagen-1, alpha-smooth muscle actin, and TFGB1. Moreover, it has been demonstrated that ozone administration decreases the expression for apoptotic genes such as caspases 139 Bax and P53. Ozone increases erythrocytes deformability and filtrability, increase the production of 2,3-dephosphogyl, reduce the platelet aggregation and plasma viscosity, activate energy metabolism in mitochondria, and increase production of ATP. In red blood cells stimulated by O3 administration, there is an increase of glycolysis rate. In consideration of these scientific evidences, we can hypothesize that ozone can influence the outcome of COVID-19 through these following action of mechanism. O3 inactivates and destroys the virus. O3 activates the cellular and humoral host immunity. O3 reduces the inflammatory cascade, cytokines storm, and apoptotic processes, along with the activation of the antioxidant systems. O3 potentiates the tissue's regeneration and the oxygenation. Here, I will show you the materials and methods and the procedures to perform the oxygen ozone therapy for the patient affected by COVID-19. Materials and methods: sterile university laboratory, ozone apparatus, bags for autohaemotherapy, needles, syringes, patches, cotton, disinfectant. Collection of 150 of blood in bags for autohaemotherapy, ozone withdrawal from the apparatus, the correct concentration, as well as the quantity of the oxygen-ozone mixture are decided by the qualified doctor in relation to the clinical case to be treated. The oxygen-ozone mixture is immediately introduced into the bag containing the blood just collected. The blood ozonization procedure is about a few minutes, and during this time, the needle and the infusion set must not be removed from the patient. The ozonized blood is mixed with the rotary movement of the bag. After this procedure, the enriched O2-O3 blood is reinfused in the patient in the same way from which it was taken. The reinfusion procedure lasts on average 30 minutes. After this, the session is ended. The treatment will be carried out once a day for 5 days. To verify the NCO presence, diagnostic detection will be performed by real-time PCR at different times: before treatment, in the bag after 30 minutes every day, after the third treatment, after the fifth treatment. This is an abstract from our first work. Other clinical trials have been performed highlighting the high potentiality of this treatment against the SARS-CoV-2 infection. Thank you for your attention. And thanks to Katia Scassellati and Cristian Bonvicini, senior researcher in my research group. For questions, feel free to contact me by email.